Good afternoon. This is Kenya Servia from the North Carolina Health Information Exchange Authority. Is anyone else on the call?
Hello.
Hello, who am I speaking with?
How you doing?
I'm good. How are you?
I'm doing fine. I was calling. I'm logging in for the training.
Yes, ma'am. We'll be starting at around noon. We may wait just a few minutes. I was just giving an introduction, and we'll be getting started shortly. So if
Well, I
you
was
want
trying to
to
log in through my email, but it wouldn't let me go. I mean, through the webinar, but it wouldn't let me. I put in the passcode, the ORH, but it, AHAP, but it wouldn't let me saying the incorrect passcode.
Okay, but it let you call in because normally you can't call in if you're not logged in.
I don't know. I don't know.
Yeah. If you're on
I
the call.
No, but it's saying when I logged in, it keeps saying incorrect passcode. So I know it's the right passcode, like you said, because I can call in through the passcode. Well, when I called the number, it told me put in the access code. But when I log in on the webinar, it said put in the passcode.
Okay. Yeah, I'm not sure. Are you able to see anything on your screen?
You won't let me, because I'm in to enter your email. I'm doing the email now.
Okay. Are you on the WebEx website?
Yes, ma'am.
So what do you see on your screen?
Okay, hold on. It's saying, okay, I did it wrong. I did it wrong. Okay. Got to put my name in there. I did it wrong.
Okay. All right. I'm going to put you on mute, okay?
Okay. All right. Thank you. Bye-bye.
Hi, everyone. Again, this is Kenya. Hi, Brenda.
Hey.
Hey, you got everything, all the kinks worked out?
I think I do.
Yeah, I think you're good. I can see you on the WebEx and you're on the call, so I think you're good.
Okay.
All righty. We'll be starting soon.
Okay.
Bye-bye.
Thank you.
You're welcome.
Bye-bye.
Hi, everyone. This is Lakeisha and Kenya, and we'll be getting started in about 10 to 12 minutes, okay? Hello, everyone. Again, this is Kenya and Lakeisha. We're over at the Office of Rural Health today. We're going to be starting in about 5 minutes, just for everyone who's on the call to make sure we're at the right place. If you have applied for funding for behavioral health programs with the Office of Rural Health, then you are on the correct call. And we will be starting our welcome call in about 5 minutes.
Good afternoon, everyone. This is Lakeisha Moore over at the Office of Rural Health. I'm joined here with Kenya Servia with the North Carolina Health Information Exchange Authority. And we've got some of our other team members gathering. We're going to get started in about 2 more minutes, just giving everybody a chance to get dialed in. Thanks so much for joining us today for the North Carolina EHR Funding Program for Behavioral Health and IDD Providers. This is our welcome webinar. Good afternoon, everyone. Thanks so much for joining us for the North Carolina EHR Funding Program for Behavioral Health and IDD Providers. This is our welcome webinar. We're going to go ahead and get started. We've got quite a few things to cover during this call. We thank you all for joining us today for this webinar, our first one officially to kind of kick off this program. And I'm hoping to share some info that is enlightening, and then questions that you may have. We do ask if you can chat those in. There is a function on the WebEx where you can chat in your question. We've got quite a few on the line, so that's why we were hoping that the chat feature would work. We'll also give you some resources if we're not able to go over your question today, because we're hoping, well, a lot of the questions that you have or commentary may get answered as we go through some of the material during this webinar. But if not, of course, you've got us and the Rural HIT Specialist, the NC Health Connect team, and the AHEC team, all here to provide some technical assistance throughout this process of getting all of those on this call connected to NC Health Connect and getting your EHRs implemented successfully. So I'll start off. I'm Lakeisha Moore. I'm with the North Carolina Office of Rural Health. And I figured to do our introductions as folks are still gathering, we would start off also with just here at our team some things that we're looking forward to for the holidays. So I'll share one thing that I'm looking forward to is spending some time with family. I've got a lot of my family is here in North Carolina, and then some family I have that's all up and down the eastern coast. So many of them typically will trek down to North Carolina for the holidays. So I'm looking forward to spending some time with them. I'll pass it over to Kenya, who's sitting right next to me. She's with the NC Health Information, North Carolina Health Information Exchange Authority.
Hi, everyone. This is Kenya Servia, again with the North Carolina Health Information Exchange Authority, and I am looking forward to getting my house decluttered. I just want to take a few days to really get rid of some excess and make room for the new in 2019.
Awesome. All right, we also have Adam Myers, who's here with us. He is one of the Rural HIT Specialists that covers our western service area here in the state of North Carolina. So Adam, why don't you introduce yourself?
Adam Myers. One thing I'm looking forward to is just my kids really enjoy this time of year, being able to spend some extra time with them and seeing them enjoy their Christmas presents for a few minutes before they move on.
No, all that work, wrapping and gone in moments. And then Mary McCaskill is joining us on the line. I think Mary's on. Mary, if you wanted to do any introductions for you or the AHEC team and what you're looking forward to this holiday season.
I may have to unmute her.
Okay, thanks, Lakeisha. Can you hear me okay?
Yeah, we were making sure some of the lines are muted when you come in, so yep, we can hear you.
Okay, great. Yeah, so we should have some of the coaches from
from North Carolina AHEC Practice Support on the line. So, we're here to help you with this program. As far as, and we'll talk a little bit more about that coming up. As far as Christmas, everything you guys said, I'm looking forward to, as well as all the kind of Christmas delicacies that you only get at this time of year. I recently found out that Krispy Kreme has bought Dewey's Bakery, which is a Christmas favorite of mine. So maybe there will be more Christmas cheer all through the year. So
I didn't know that. That is breaking news. Okay.
I didn't either. I know. I just found out.
Wow. Thanks for sharing. All right, we'll get ready to get started. Once again, thank all of you that are on the line. The majority of participants on the line are part of the North Carolina EHR funding program for behavioral health and IDD providers. But we also recognize there may be some other behavioral health providers that are joining the call as they want to learn more about implementing an EHR and then also getting connected to NC Health Connect. So we are thankful for all of you for joining us and for working with us through this funding program. We'll go to the next slide, which kind of outlines what we'd love to cover today. I know our time is a little bit limited with the amount of information we want to cover, but really the takeaway from today is you have a team here to support you and help you with implementing your EHR and then also getting connected to NC Health Connect. So this is not, don't feel like if you didn't get all your questions answered today, this is the end. This is truly the beginning, and we want to support you and your practices in whichever ways that we can. So we just did our welcome. I'll go through a little bit of the who, what, why, when, where, and how for this program, because this is a new program, so I think that might help those that may have questions just about the program in and of itself and the process for reimbursement and getting connected. I'll walk through that. But then also we'll spend a good amount of time on a lot of the technical assistance resources that are available to you and your organizations as you get connected. So you'll hear from the Office of Rural Health, Health Information Technology team. You'll hear from the Area Health Education Center team, and then also the NC Health Connect team. Their representatives are here. We'll go through some ways that you can receive resources and assistance to getting connected. So to jump into the program itself, goodness, I guess it was probably earlier in this year of 2018, pretty early in 2018, the North Carolina Department of Health and Human Services, the Office of Rural Health, North Carolina Medicaid, the NC Health Connect team, and then also, it's also known as the North Carolina Health Information Exchange Authority. That's the group of people that oversee NC Health Connect, our statewide health information exchange. All of us came together and had AHEC at the table with us too, just with their expertise and knowledge in EHR implementation and practice support. We all came together and we launched a program, so that the program that you're a part of now, to help assist behavioral health and mental health and IDD providers with purchasing an EHR and ultimately getting connected to the North Carolina Health Information Exchange, NC Health Connect. So I'm going to go to the next slide. As part of that program, we put together some guidelines of, once again, of who, what, why, when, where, and how, just to really narrow in or hone in on providers that we recognize may have not received any type of meaningful use funds or any type of incentive funds in the past, but still needed to get an EHR to get connected. So just to go over quickly, the eligibility for this particular program is designed to support healthcare practices, behavioral health and IDD practices that are Medicaid practices, outpatient practices. You do have to have an active MPI number and NC track, because that is how you will actually get your reimbursement once you get connected to NC Health Connect. You also needed to provide behavioral health, mental health, or IDD services, and there was a taxonomy list that was included. So once again, those of you that are on the call, it's because you met this criteria. You did have to self-attest that you had not received EHR funding before. Once again, wanted to focus on those providers that did not have a chance to get previous funding to get an EHR. And then the last two, you did have to attest that you didn't have an EHR, or if you had a practice management system that maybe could have been upgraded to an EHR, that is something that would consider you to be eligible for this funding. We really tried to target in on behavioral health providers and practices that did not have an EHR. And then lastly, just 75% or more of your providers needed to be affiliated as behavioral health, mental health, or IDD. So once again, that's just a quick overview of who was eligible for this program, but all of you that are on here, that is what you self-attested to, and then also we did have the NC Tracks team do some of those checks to make sure that you fell into that eligibility criteria. And the what for this program, really we were looking at helping behavioral health providers implement an EHR, but then also get connected to NC Health Connect. And we'll talk a little bit about, Ken, you'll actually share a little bit about the mandate for behavioral health and other healthcare, Medicaid providers and state health plan providers to get connected to NC Health Connect. But the way this program works is, if you look at that third bullet, it is a reimbursement program. So we will reimburse through this program the cost of your EHR software, that technology, in order up to the amounts that you see in the table. And once again, that reimbursement happens after you are connected to NC Health Connect. So there is a process to get connected to NC Health Connect that we will go over, and we're actually going to spend a little more time on that. Our January call is going to be all about NC Health Connect, so that'll be a time to really kind of dig into that. First things first, you've got to get your electronic health record selected and go through that contracting and implementing that before you even, kind of start down that road to connecting. But ultimately, we want to be able to talk to you about getting connected because that's how you'll get reimbursed. The other part to this program is just the big why behind, why did we develop this program? And it really it boils down to a lot of reasons, but, if we were to bullet it in two, we recognize that many behavioral health and IDD providers don't have access to critical patient information such as labs and allergies and just, when you talk about whole person care, it's challenging to do that when you don't have a lot of the information you need on that patient. So that's what NC Health Connect is able to provide is that portal where you can search for patient lab information that may not have been done at your organization, but you can log into that portal and actually see where else that patient has been, what other touches they've had in the healthcare system. So once again, we'll talk about that a little bit further down the line. We definitely want to get everybody to the point where they've got an EHR where they can start to share information they have in their system with others that may be caring for that same patient. The other part of that is just recognizing that the North Carolina Health Information Exchange Authority, as many of you are implementing an EHR, maybe for the first time, or you've had an EHR before that maybe you found wasn't compatible with getting connected to NC Health Connect, we want to make sure that as you're making those choices, you're choosing EHR technology that can connect to NC Health Connect. So there is a list that your rural HIT specialist sent out to you. The list is also available on the NC Health Connect page, but that list will actually give you those EHR vendors, electronic health record vendors that we know can connect to NC Health Connect. But then also if you have a vendor that you don't expressly see on the list, as long as the vendor you're working with meets minimum technical specifications, once again, these are things that we can kind of help coach you through, then you're okay to choose that vendor. You just want to make sure whatever vendor you choose, they are actually able to get you connected, since that's the way you get reimbursed. And so I'll turn it over to Kenya as we talk about also the whys behind this program. A big why is there is a mandate for those that receive any type of Medicaid or state funds or even funds from grant funds from the state that they need to be connected to NC Health Connect.
Thanks, Lakeisha. As Lakeisha was explaining to you, in 2015 there was a law passed that required healthcare providers to be on an EHR, and there is notation here where you can actually go and visit the legislation and read it in more detail, but really want to reiterate the time frames here, because a lot of times we get conversations or calls from providers that are feeling pressed about the short span of time that they have to connect. So as you see here, our first cohort of providers that had to be connected was this past June 1 of 2018. That meant all the hospitals had to connect, everyone that was a doctor or a mid-level practitioner, which was a nurse practitioner or physician assistant. And that they had to be connected June 1 of 2018, and if they were unable to connect, they were given until June 1 of 2019 with an extension to allow their EHRs time to build the connectivity. And as you can imagine, we're still working heavily in that provider type, working to get those providers connected. And we're quickly approaching the next deadline, which is June 1 of 2019, where it states all Medicaid and state-funded service providers without technology. And that's pretty much everyone on this call who does not have an EHR in place, and they have not signed our contract, which is our participation agreement yet, to say that we are allowed to get the data that we need from your EHR. So pretty much everyone that receives state funding or NC Medicaid. And I do want to reiterate that by state funding, that could include the Blue Cross Blue Shield state health plan. So we often have providers who say, I don't accept Medicaid reimbursement, but I see state employees, then that counts. Also, if you receive any other grants from the state, or if you see any state retirees that receive benefits from United Healthcare, that's also included as receiving state health funds. And since many of you on this call are behavioral health, or all of you are behavioral health providers, it's important to note that the LME MCO populations will not be required to connect until June 1 of 2020. And after that, the last ones bringing up the rear will be the dentists and the ambulatory surgical centers. They're required to connect by June 1 of 2021. And then our pharmacies will connect with pharmacy industry standards by June 1 of 2021 as well. I do want to make one other point, is that those who are required to connect by June 1 of 2019 will be, whose technology is not able to connect immediately, will have a year until June 1 of 2020 to allow their technology vendors or their EHR systems time to build the capacity to connect to NC Health Connect. And that is something we'll go over in detail in a later call.
Great, thanks, Kenya. And I know that may be a lot of info to take in here. So once again, if you have questions as we're going through, absolutely, you can chat those into us. We'll try to get those answered during today's call. And we'll once again also just leave our contact information either for your Rural HIT specialist or NC Health Connect team or the AHEC team, so that you're able to follow up with those teams depending on where your question lands. I'll kind of round it out. We talked about the who, what, why, when, where, and now we're going to talk about the how this program works, especially the reimbursement piece. So the question is, how are payments made, and then what's the process for reimbursement through this program? So just recognize that payments are made through NC Track, so you want to make sure that you keep your NC Track, basically your Medicaid information updated, because that's how your payments will come to you. The same way you get paid through for your other Medicaid reimbursements, this will come through NC Tracks also. And then also just recognize that if most of you that are on the call are actually part of the behavioral health program, but in the event that we have other behavioral health providers that are not part of the program, of course, you wouldn't be able to get reimbursed through this program, because you have to be, have signed a memorandum of agreement with us, which most of you on the call have probably already done that. You've heard from your Rural HIT specialist that sent you that MOA, memorandum of agreement. So basically, you just need to be in the program in order to get reimbursed through this program. And then lastly, just recognize that the way that you get reimbursed is once you've actually connected to NC Health Connect. So once again, we'll dig into that process a little bit deeper closer to the end of this call, but then also next month we'll spend really that whole call, January, talking about that connectivity process and just going over what NC Health Connect is and how it works, just so you have a little bit more information. First things first, we want to make sure that you guys get your EHR selected and implemented so that you can successfully connect to NC Health Connect. I did want to quickly share some of the stats for this program, though, just to give you an idea. This is our first time targeting the behavioral health and IDD providers for this type of funding, for electronic health record funding. And so we've opened this period up, the application period up, for about a month. Once again, we started talking about the nuts and bolts of this program early in 2018, and then we were able to get the criteria that I went through earlier and open it up for applications in May. Try to advertise through NC Health Connect, many of the Division of Mental Health channels, just getting the word out. So we had about 243 behavioral health and IDD organizations that applied that were eligible for this funding. And then we had about 179 behavioral health and IDD organizations that were awarded. The 64 that were not awarded, it was either because they didn't meet that criteria that I went through earlier, or there were some, just a few that did not provide the proper attestation to say that they were eligible for the funding. So we're happy to be able to fund as many as we were through this particular funding program. And just to give you an idea of how that breaks down dollar-wise, there were about 154 organizations that fell within that 11 or fewer providers. There were about 18 that were what we consider between 12 to 25 providers, and 7 that had 26 or more providers. And just, I will kind of put a little pin here as we talk about providers, because once again, like I said, this was a new program for us that we were putting together, and I think there's been some things that we say, hey, this went well, and there's some things that we say, well, we might define that a little differently next time. Providers are defined as those that are licensed clinicians with your organization, and so that's, for some of you that say, well, yeah, I have quite a few people that are on my staff that provide care. Just recognize when we were doing the counts, we consider providers those that were licensed clinicians. Then here I will just kind of talk through that reimbursement process, because here at the Office of Rural Health, we're helping to provide technical assistance for this program, and we get quite a few questions around okay, what am I supposed to be doing next? So I just wanted to visually go through this, and these slides we absolutely can share with you. We're recording the call too, just so you have a lot of this information for reference, or if you need to share it with other staff members. But just realize that by now you should have your memorandum of agreement signed. If you haven't done that, please reach out to us. We've got our contact information in this particular webinar, so we'd love to make sure we touch base with you if you have not signed MOA or memorandum of agreement yet, because that's how you get started with this process of getting reimbursed. But after you've signed your MOA, that's where we really encourage you to work with AHEC Practice Support, the Area Health Education Center in your area, because they can help you with, one, selecting an approved EHR vendor, because you'll want to make sure you're choosing a vendor that can connect to NC Health Connect. But then also they can help you with that implementation piece, that selecting an EHR, contracting with an EHR, and then really implementing it into your workflow. And Mary McCaskill will talk about some of the AHEC practice support services in a moment here. Then the third step is we really encourage by May of 2019 you to sign your North Carolina Health Connect participation agreement. So NC Health Connect, remember, is our statewide HIE. That's where, that's our goal. We want to get connected to NC Health Connect after that EHR is implemented. But in order to get connected, you do have to sign a participation agreement. And so that January call, we're actually going to walk through that participation agreement together. Kenya's going to walk us through that. Just want you guys to be familiar with that, because that document is what you'll need to fill out in order to get in that process of getting connected, in addition to, of course, having your EHR. And then we've got some practices and some organizations that we're working with that actually are in that process. They've already kind of started down that road of selecting an EHR. They've signed their participation agreement, and they're actually in the process of getting connected. I think at last count we had about 4 organizations that let us know, yep, we've already signed our participation agreement. Yep, we're, we've implemented our EHR, and we're really close to getting connected. So we're excited about that, because that'll be kind of our first group that we see crossing that finish line of getting connected to NC Health Connect, and they will be able to submit documentation for reimbursement. And that kind of takes us to that last step. If you're in that boat, if you can definitely reach out to your rural HIT specialist and let them know, exactly where you are in this process, or once again, if you need assistance during any of these steps, we're all here as a team to help you get connected. The last step, though, is you would reach back out to your rural HIT specialist and say, hey, I've got my participation agreement, I'm fully connected. You'll get a welcome packet once you are connected to NC Health Connect. And you'll know because you'll also get credentials to sign into the NC Health Connect portal. And that way, that once again signifies to us, I typically will check with Kenya just to say, hey, we're just verifying that this organization is live in production. And, once Kenya gives us the okay, the NC Health Connect team gives us the okay, then we will submit your name for reimbursement through NC Track. So once again, I know a lot of steps to take in, but we'll go to the next slide, which shows where the rural HIT specialist can kind of help you wherever you are in that process with making sure that you're taking that next right step. So we're broken up here at the Office of Rural Health. Our HealthIDD team is split up in regions, and these kind of align to the North Carolina Medicaid region, so that's why the drawing might look a little bit interesting, but really over to the western part of the state, so if you're in any of those counties, that are shaded in yellow or kind of a mustard color. I don't know what you call that one, but that would be Adams. If you're towards what we call the south central part of the state in blue, that is Adonica Rowland is your rural HIT specialist. And then if you're towards the top right, in what we call the eastern part, although I know some of those in the middle might say, well, I don't know if we've been lumped in the east before, but this is kind of how we draw the line based on the Medicaid region. And having 3 rural HIT specialists, it's Sebastian Jimenez. So the email addresses are there for you, and that way if you have questions about that reimbursement process that I just went through or just the steps to get connected, we can definitely help point you in the right direction. Lastly, I did want to put out there just for you to save the dates. As we said in the beginning of this call, we don't want you to feel like you've got to master all of this at one time. We are doing monthly calls to the next 6 months. We're really hoping that by the June timeframe, most of you on the call are at that point where you have selected an EHR and that you're working through that implementation process and you signed your Health Connect agreement. But every month we'll meet, and if you have questions in the meantime, please, send those over to us. If you have questions now, you absolutely can chat them in, and we'll try to address those today too. But our next call will actually be on January 11th. We'll spend some time going over the participation agreement and talking a little bit more about NC Health Connect. And then just some other resources for you that we wanted to make sure you're aware of. The North Carolina Health Connect team does have a How to Connect call, usually on the last Monday of each month. So the next one is actually coming up on January 28th, and there is a link to register for that call. So we'll make sure we get these slides out to you. We have your email address. We'll get the slides out to you so that you have this information if you want to register for that next How to Connect call. Then lastly, the NC Health Connect team does also have a behavioral health work group, and that group is a great group to join. I've been to a couple of their meetings. I really love it. Kenya Servia, who's here with me, she leads up that group, and it's great because a lot of the behavioral health organizations that are part of that work group have already implemented their EHRs, electronic health records, and they're just a great group to kind of kick ideas off of if you're having some challenges or just want to know, hey, what's it like working with this vendor, or, I'm having trouble with this report, or even if you want to share successes of, oh, I've really enjoyed working with this EHR vendor. It's a great group. They also talk about a lot of the NC Health Connect possibilities and just the data that will be sent in to NC Health Connect. So just a great group to learn more about NC Health Connect, but specific to behavioral health. So I'll get ready to turn it over to Mary at AHEC. And once again, like I said, if you have questions that are popping up, please chat those into us. We will try to go over those towards the end of this call. Thanks, Mary.
All right, great. Thanks, Lakeisha. Can you hear me okay?
Yes, thanks.
Okay, thanks. I have a habit of being on mute when I start. Excuse me. Good afternoon, everybody. My name is Mary McCaskill, and I'm the Health IT Manager at North Carolina AHEC. And we're really excited to be a part of this program and are, excuse me, very much looking forward to working with participants on getting up and running on an electronic health record and connecting to North Carolina Health Connects. First, just a little bit about North Carolina AHEC for those. I think you can go back one slide there. Okay, thanks. So AHEC, I guess I'm not sure really how many in this group are familiar with AHEC, so just a little bit about us. The AHEC started in the 1970s as a way to help rural practices train and retain healthcare workforce for rural North Carolina. And our mission is to meet the state's health workforce, basically education needs, and to provide education programs to improve the health of North Carolinians, and mostly focusing on underserved populations. And our vision with this is to lead the transformation of healthcare, education, and services. Next slide. And so to meet our mission and vision, AHEC has 6 fundamental service lines. Historically, we're known for the education that we provide, both through residencies and continuing professional development, to make sure that North Carolina healthcare workforce is meeting the needs of the patients in the state. We also have a robust library services that includes the AHEC Digital Library. The Digital Library is an online resource for journals and literature that spans the healthcare ecosystem. And you can find out more about these services on our website at northcarolinaahec.net. Next slide. But today I specifically wanted to talk about our practice support service line at AHEC. We've been around for about 10 years now, so we're kind of young in the AHEC world. And so we are here to help providers and clinicians in North Carolina implement electronic health records, transform care to meet the requirements of value-based payments, and to improve the quality of services to patients. Next slide. Yeah, I think next slide. Somehow we got, so we have practice support teams in 9 regions of the state that cover all 100 counties. When you look at this map, the black dots represent where the teams are located, but they do travel a lot. Each team averages about 3 practice transformation coaches that are able to come out and give on-site services and on-site consultation to help you, for this project, implement electronic health records. Next slide. All right. So as I mentioned, we're really excited to work with the participants in this program on EHR implementation. We do have experience in using these steps of kind of pre-work, assessment, planning, selection, implementation, and optimization of electronic health records to make sure that the folks that we were working with make the most of this opportunity. We realize that this is a very challenging notion for some and can be a tremendous undertaking given the financial and the human resources involved in being successful in implementing an electronic health record. So, we're here to help you through the process. I think, like Keisha mentioned, it's not mandatory that you apply for our services, but hopefully we can be a helpful part of making you successful in this program. Up until now, I will say that our EHR implementation experience has been mostly with primary care practices, and this is simply because that's where we've been funded to help. So again, we're really looking forward to this project and really learning the best practices around how behavioral health clinicians and service providers use their electronic health record, what works, what doesn't, and then be able to share what we learn quickly across the state so that all will benefit. So I think this series of webinars is a great way to do this.
Great.
Next slide. And so to to apply for our services, there's an online application. The link is on the slide. You can also, if you visit the northcarolinaahec.net, you can find your AHEC for your region and find the phone numbers there if you need to contact the region locally. If you have any trouble with the application, my email is here on the screen, marymccaskill@med.unc.edu. Feel free to contact me if you have any trouble with the application or you have any questions.
Great. Thanks so much, Mary.
So at this point, thanks, Mary. That was very informative for me because I do get lots of calls every day from providers who are interested in getting additional assistance in procuring an EHR. And I'm also looking forward to, as we work with the providers that have signed up for the funding, just learning how to answer the questions better for the ones who call into NC Health Connect and the ones who send us emails, on a daily basis and want to know the steps and what it comes with procuring an EHR. But before I move forward, I think we want to stop to answer a few of the questions that have come into the chat, just to make sure that if there's anything that we do need to cover as I close out this presentation. Lakeisha, what is that?
Yeah, so I'll go over the first one, and actually this one may be one for you, Kenya. This is for behavioral health. Is there a requirement to have the connection bidirectional or unidirectional is unidirectional from the provider enough?
Unidirectional is enough. There is no requirement to have either a bidirectional or a unidirectional connection. I will say that to utilize some of our value-added features, for example, the North Carolina Immunization Registry, I do believe that a bidirectional connection is the preferential connection if you want to utilize that service. But again, to connect to NC Health Connect and to be compliant with the mandate to connect, it does not matter whether you build a unidirectional or a bidirectional connection.
Yes, as long as from your EHR, NC Health Connect is able to receive. I think connected is defined as at least twice a day that you're sending your patient data over to NC Health Connect. I know there's some that have been really interested in the bidirectional piece. So if that's something that interests you, then absolutely, if you want to work through your role head specialist, and we can loop in the NC Health Connect team if that's something you're interested in. But like you said, as long as they're sending their patient data at least twice a day, then that is enough. There's also a question, if we can please clarify, that I may have this is, I think, for Office of Rural Health, because this is something that goes back to the program requirement. Please clarify that I must have my EHR selected and payment made for it by January 2019. That in order for me to receive reimbursement, I must have the EHR in my office along with it being connected to the HIE for at least 90 days in order to be reimbursed. So we get quite a few. This is Lakeisha Moore with the Office of Rural Health IT team. We do get a lot of questions about the whole reimbursement process. So in the memorandum of agreement, we did ask that you select your EHR. So select is the word we used in the MOA by January of 2019, which we recognize that is a few short days away. So we really have been working with the NC Health Connect team. Kind of initially when we put a lot of these deadlines in place, it was to get everybody connected by the June 1st, 2019 date. So we are in the process of looking at, hey, recognizing that the mandate is still for you to be connected by June 1st, 2019. And we'll kind of get into this a little bit more in the January call as we dig deeper into NC Health Connect. But Kenya did mention this a little early on. As long as you are in the process of getting connected, so in other words, you've got your PA signed, your participation agreement signed, I would say no later than May. Anyone that's in that queue or at least showing an intent to get connected to NC Health Connect can have up until another year, June 1st of 2020, to get connected. So I know that's a little in the weeds, but I would say for the person that asked that question, let's go ahead and make sure we get you to that point where you can get your EHR selected. If you need assistance, I know Mary just went over, AHEC is definitely a great resource for that. That kind of brings me to the next question, which someone asked was, hey, is there a charge for AHEC services and AHEC helping me to select my EHR? So Mary, I don't know if you wanted to transition into that.
Okay, sure. As far as there is no charge for our assistance. It's paid for through your tax dollars. So we get funding from North Carolina Medicaid as well as federally to help folks with this. All that is required is that you do take some sort of public payment like Medicaid or Medicare, and I think anybody that's in this program does. So, so there's no charge.
Awesome. So there is free. So you've got that resource to help you. But yeah, we really want to make sure that everybody is connected by the mandate connected dates. That's really more of our focus as we set out a lot of those deadlines. And insofar as the reimbursement piece, the way that you get reimbursed is actually by being connected to NC Health Connect. So if you look on the NC Health Connect webpage, you will see a list of the providers that are quote unquote connected. So those are people that are sending in their health information data to NC Health Connect. And once again, connected is defined as at least twice a day that you're sending your patient data over to NC Health Connect. There was a question about December 8th. I think that's the latest list. So basically the latest list is on the
yes,
website.
what's listed on our website is the latest numbers that we have as far as connected EHR providers.
Great. So you want to be on that list in order to get reimbursed. Once again, as you communicate with your rural head specialist that you're assigned to, if you're part of the funding program, and let them know that, yep, you know, I got my connection, my welcome packet from NC Health Connect that shows that I am, you know, basically live in production, then we also verify that with Kenya on the back end just to make sure that we've got this connected. But what's nice is that information is also on the website. So if you have a question about whether you're live in production, you know you signed your participation agreement, you received that letter from the NC Health Connect team that tells you that you are live, that definitely is enough for us to know that you are connected, and then that's how you start that process of getting reimbursed. You need to be connected live in production. The other question we have is, are we sending patient/client registration only, or are we sending also the appointment? That gets a little more, maybe we'll put that into next, yeah, we'll definitely, thank you for sending that in, because this kind of cues up the NC Health Connect piece, because honestly, we knew today, with this being our welcome call, it may be just information overload, trying to get into some of the weeds of the NC Health Connect piece. So we're going to kind of talk about that a little high level today, but we will queue that question up. Thanks for sending that over for our NC Health Connect piece in January, when we get a little bit deeper into what needs to be sent. Two more questions we'll go over. Looks like it was saying, regarding sending patient data at least twice a day, we only see Medicaid clients twice per week. So I guess some folks are like, hey, we just don't necessarily have the volume to send over twice a day. Do you want to get into that now? Or?
Yeah, because I do want to clarify. We don't, and not necessarily say the twice a day requirement, because even if you're only seeing patients once or twice a week, you are doing some type of documentation. You are entering your EHR or viewing something, and we get the data that we need is extracted automatically. So the twice a day requirement is met without you having to do anything. It's done on the back end behind your EHR. So NC Health Connect will gather everything we need more than twice a day. We'll get it every time you enter or close out a chart in your EHR system. So in a way, it's almost as if that is a moot point, because we get the information that we need without you having to do anything.
And then I had a question here about
someone has a daytime conflict.
Yeah.
The calls will be recorded. It will take, after this call ends today, I have to send it to our DIT help desk, and it requires them to do some editing and then splicing it, and there'll be a YouTube link. So it will be sent out. I can't say how long it will take because I'm not in control of that, but I send it to them after I listen to the recording, and they splice it down, and they'll send it back out. So hopefully it'll be out before the next call. But in the event that it's not, all the recordings will still be available via a YouTube link after this call. So if you don't get a chance to participate because you're working during the day or for any other reason, you'll get a chance to go back and watch the recording. And you'll have our contact information, and you'll always be able to reach out to us to ask any additional questions you have. So from there, I'm going to do, like Lakeisha said, a high-level overview about who we are at the North Carolina Health Information Exchange Authority. And this is just going to be kind of a cliffhanger because we are going to leave you with lots of questions today, but we do understand you can either save them for then to allow us really time to develop the next call so that we can really help you. But this is just going to be a high-level overview about who we are at the authority. So we're the state-designated health information exchange, as Lakeisha stated earlier, and we are the North Carolina Health Information Exchange Authority, which is the body of people that administers the state-designated mandate to connect to NC Health Connect, which is the actual tool that connects the EHRs together so that the providers can communicate with each other. It's a secure statewide network, as you can see here, where physicians and other healthcare providers can share important patient information. And the goal is that you can communicate with different provider types about a patient that you have in common to allow you to see a bigger picture or a full picture of that person's health care. Now, at the North Carolina Health Information Exchange Authority, we're housed within the Government Data Analytics Center, which is a part of the North Carolina Department of Information and Technology. We work with SAS Institute, who does all of our technology building, and they're the ones who work closely with the EHRs to help build the connection to NC Health Connect. We also, as Lakeisha mentioned earlier, work with the Department of Health and Human Services. We work with Medicaid. We're also working closely with AHEC. So we have partnerships all around the state, and we value our partnerships, and we really want to leverage those partnerships to provide better services to you as the citizens of North Carolina. So the vision for connectivity, and this is pretty much what Lakeisha was stating earlier, it really is pretty much to break down those silos that existed. So you can get anything that you need about allergies concerning your patients, hopefully to improve health outcomes, to help you with reporting and other things that are required by the state in order for you to maintain your funding. So that's the ultimate vision, you know, to create outbound services to give providers insight to their at-risk populations, because we know that there are a lot of times where the behavioral health provider and the medical provider may not communicate. So we want to break that down and really help everyone to be on the same page when providing care for their patients. So to do that, it looks like this. You have all the different provider types, the ambulatory care, the primary care, you have the behavioral health providers, and you have public health. You have everybody on one platform. Everybody has their own EHR, but they're all able to provide data into the HIE, which is NC Health Connect. And it allows you to really see a full picture of that person's care. Just, can you imagine, you know, being able to see the lab results without having to reach out to LabCorp? Or if you have a patient that goes into the hospital and being able to see the discharge summary or any new medications that they were prescribed without you having to reach out to the hospital to get that information, you can access it readily through your EHR or through NC Health Connect, depending on the type of connection you have built. So that reiterates the clinical benefits. Doctors can have improved diagnosis. You as behavioral health providers can have more accurate and timely medication reconciliation and reduce any errors and avoid unnecessary testing. You know, no one wants to spend money on a test that they don't need. So if we can avoid that by communicating with each other, that's the purpose. And there's more than what's listed here, but that's just an example of what we can do if we work together as a team to improve care coordination. So the question is, how does it work? I really put this slide here because I can't reiterate enough that you have to enter the data in through your electronic health record. Presently, there is no way around us getting the information we need apart from you putting it in your EHR. And NC Health Connect sits on the back end. So nothing that's put in NC Health Connect is changed. It's only for you to view and query information about patients that you have in common. Again, NC Health Connect is our clinical portal that only allows you to view information. Nothing is changed once it's entered in there. So you get to see the information that the oncologist may be keying in, the podiatrist or what have you, whatever type of healthcare practitioner. If you have a patient in common, you'll be able to see information about that. And all the data is protected. It's safe there. It's a safe place. It's the highest security standards possible are utilized when in NC Health Connect. So we comply with all the HIPAA and the HITECH Act regulations, so you don't have to worry about if there's any action or anything that could possibly cause any information to be shared. We don't sell the information or anything like that. So the technology that you have to have in place, again, you have to have an EHR, and it has to be minimally capable of sending us a CCD or an HL7 version 2 higher message. And that is all that is going to be determined by your EHR. I do want to reiterate, on our website, we do have a list of connected EHRs. You're not required, because you receive this funding, to connect with the EHR that's on that list. But we do want you to know that if you choose an EHR that is not able to connect, it's going to slow down the process, and we don't want you to miss the windows that would allow you to get reimbursed from this program. So we do want to make sure that you are working with us so that we're helping your EHR vendor that you choose understand what their minimal requirements are in order to connect to NC Health Connect. And the participation agreement, that lovely 52-page document that I'm sure many of you have dreaded and seen on our website, we're going to go over that in detail in the next presentation, so you'll get a chance to really go through and see what it looks like and go through, and hopefully you'll have it queued up during the call so we can go through and complete it together. But you can access that here on our website by logging into the How to Connect portion of our website. And this just also reiterates that you do not have to apply for an extension. Extensions are granted automatically, and this slide has been updated, but the same applies for those who are required to connect by June 1 of 2019. You do not have to send us anything to say that I need a longer amount of time to connect to NC Health Connect, because my EHR vendor needs to do some coding to be able to connect to NC Health Connect. Once you complete your participation agreement, you let us know which EHR vendor you are choosing to work with, then that shows us that you're making a good faith effort to comply with the mandate. Therefore, you don't have to send us an extension form. You will automatically be given until June 1 of 2020 to have those technology conversations. Again, we're going to talk about this in a high level during the next call, but there's lots that you can be doing during the waiting time. There's lots of things that you can be preparing for to make sure that once you are connected to NC Health Connect, you can actually utilize those features and get the biggest bang for your buck, so to speak. Even though there's no cost for connecting to NC Health Connect, there will be costs most likely from your EHR vendor. So you do want to make sure that you're using this time to make sure you're making the best decision for your practice and the best business decision for your practice. And again, I alluded to the participation agreement, and this here is just to show you what you have in store for our next call. This is kind of the cliffhanger that we're going to leave you with, is that participation agreement. We want you to know that it's coming. Don't be intimidated by the 52 pages. There's really not a lot once you look at it. But use this time between now and the next call to read the document. If you have legal counsel, have them read the document so that you understand what you're signing on for. And that is going to conclude my portion. We are going to go back and see if there's any additional questions at this time that we maybe didn't hit. I'm looking at there's 5 minutes to 1, and we do want to be respectful of everyone's time. We appreciate you giving up your lunch break today. So we want to spend this last 5 minutes if there's any questions that we can answer. And if not, we will follow up with you via email. I can't see.
Oh, yeah, sorry. I did see one other question that came in from Barry Graham. Barry, we do have you, this is Lakeisha with the Office of Rural Health, so we do have your behavioral health organization here. We have your MOA. So I think your next step, I can ask your rural health specialist to reach out to you. I believe it's Adonica, based on the county that we have you aligned to see if you need help. If you already have your EHR, then we can start working on that participation agreement that Kenya just talked about. If you don't, then we can absolutely see if you want to connect with AHEC if you need some help with implementation. But we can follow up with you, Barry. I know you mentioned in your question that you didn't see your agency on the list, so I'm not sure if you're saying the list on the NC Health Connect page of those that are live.
Yeah,
but
you wouldn't be on that list yet, Barry. It's a little early for that list, and to be honest with you, that list doesn't change a whole lot. It's a lot that goes on behind the scenes before a provider can actually get on the list of connected providers. Mm-hmm. But even the providers that are in process before they're actually live and in production, if they submitted their participation agreement, they're able to go ahead and start querying the clinical portal. So there's some benefits to go ahead and getting your participation agreement in as early as possible, even before your connection is built, so that you can be compliant with the mandate.
And I think that was the only question we had, the only additional question we had. If you still need, I know sometimes you may have some specific questions to your organization or just want a little more clarity, by all means, like, I think each of those that are awarded is assigned to a rural health specialist, and if it's something that our team here, Office of Rural Health, is not able to answer, we work very closely with Mary McCaskill at AHEC, especially if it's more of like a EHR implementation question. We do kind of do a warm handoff to make sure you get connected to the right area health education center. If it's NC Health Connect related, we definitely work with Kenya and her team closely too. But yeah, if you feel like you just need a little bit more, absolutely reach out to us. I'll double check with Kenya and Mary that they're okay with us sending out these slides, because if they are, if you guys, oh, okay, I'm getting a head nod here. And Mary, if you are, then we can.
Sure.
Oh, great. We'll send out, we'll send out a PDF of the slides. It's not as big of a file for you guys. And then that way you have this information, and you'll have our contact information too. So thank you all so much for joining us for this initial call. I know it was a lot to take in. Thanks, Kenya, for recording this for us. So we'll get that out as soon as possible, but we should be able to get you guys the slides. If not today, definitely early next week. We'll make sure to get the slides out to all participants so you have that information. And then those that have some conflicts going forward, we'll make that the standard where we'll, as long as the presenters are okay with it, we'll share those slides with you afterwards so you have them for reference. Well, everyone have a wonderful weekend. It's a little rainy. I don't know exactly. I think all of us in the Carolinas are getting rain this weekend, so I don't know if anybody has escaped, whether you're west, east, or in the middle. But have a wonderful weekend. Be safe out there, and we look forward to connecting with you really soon in January. Happy holidays if we don't talk to you before then. Take care. Bye-bye.
Bye.
Thank you.